And I want to thank you all for showing up today and joining us for our first branch out session of 2022. Today, I'll be talking about life values and chronic pain management. As I said before, everyone has been muted, and with the recording, there'll be no names that are identified or any identifying information, just to keep your privacy for you. And this is also a really special topic to me. I think talking about values and what happens to them in the context of chronic pain can be incredibly important to talk about. So I'm excited to talk about this topic, but also that we have such a high number of people who had registered. So if we do have to let a few people in while during the presentation, it shouldn't be too disruptive. So without further ado, I'll begin first with a little bit of an overview. So again, I want to welcome you. And with each of the branch out sessions, I've been going through the 4 systems of responding. And I think this is really important to reiterate, because when we think about and conceptualize our experience with pain, so often it has been done within a one dimension, which is just mostly the physical system. So I'll talk about that, as well as other 3 additional systems that are just super important when talking about pain management. Next, I'll get into the fear avoidance model of chronic pain, in particular, how value-guided behavior is impacted by the experience of pain. And then getting into what is primary and secondary pain, what do we mean by that? And then lastly, you'll get into how you can get back on track in your life using life values as a behavioral compass. So I like to start with just a little bit of a story. And this is a story about my journey. So I've been a pain psychologist for about 24 years. When I moved to California, I'd been specializing in pain management for a few years. And about 17 years ago, I started doing Brazilian Jiu-Jitsu. And I had some colleagues initially who would joke with me and say, "Oh, you're getting into this so that you can hurt people and make business for yourself." And we joked and thought that was kind of funny. But the reality is, I think that this brought me closer to understanding, what am I actually doing in my profession, and how am I helping people, and being able to have a different perspective. Aside from the multitude of bumps and bruises and injuries here and there, I've had some pretty significant injuries that have led to chronic pain. So I present today as not only a professional pain psychologist who has expertise in this area, but also as somebody who truly understands what is chronic pain and how does it feel, how does it impact your life in many different ways. So I just want to acknowledge that and start with that story to also acknowledge each of you and your journey and history with the various experiences that you've had with pain. So looking at the 4 systems of the responding, this is the physical system that most people identify with initially, anyway, when we talk about chronic pain. This is the physical nature of pain. It also includes our breathing, muscle tension, blood flow, circulation, heart rate, blood pressure, on and on. All of the biological factors associated with the experience of pain. But of course, there's also the emotional experience, and I've been known to say that you can't take the emotion out of pain any more than you can take the sugar and milk out of a cookie once it's been baked. Emotions are part of the experience. And looking at your own experience, think about, have you experienced fear, anxiety? Have you ever felt depressed or hopeless? But of course, as human beings, we have a vast range of experiences, including happiness and joy, gratitude. But other emotions like shame and guilt can also occur in the context of chronic pain. So emotions are absolutely part of that response system. The third is our cognitive system. Later part of last year, we had a couple of branch out sessions on this topic specifically, where we look at different thought patterns, expectations. One in particular, catastrophizing, where you think about the absolute worst possible scenario and the idea that there's no way that you can have any control. And this type of thinking pattern, I'll highlight in just a moment when I go through the fear avoidance model, can lead to a lot of disruption across these systems. So the cognitive response system also includes our mindset, or the way that we look at our situation and our ability to cope and manage. And then last is our behavioral system. This includes whether or not we avoid or leave situations that could be associated with distress, pain, anxiety, fear. We may have hesitance or procrastination. But on the other end of the continuum is engagement, and whether or not we approach and connect with things. And this is the specific system that we're going to be talking about today. But collectively, there's a dynamic interaction among all of these systems. So think about a situation where you just have a thought. In this case, what I like to do is the lemon experiment, where if you imagine cutting a lemon in half, and if it helps you to do this, just close your eyes for a moment. Imagine holding that half of a lemon, big juicy lemon, and take a big bite into it. Just really squeeze those juices. And as you imagine doing this, do you have a physical reaction in your mouth? Do you start to feel the taste buds on the side of your tongue start to activate? Maybe some salivation. Did this actually happen? Did you bite into a lemon? I can't see any of you, so I don't know if you actually did or not, but probably you had the thought of doing this, and the thought triggered a physical reaction. So this is just a simple example of how these systems can interact in dynamic ways. Our behavioral system will, of course, impact our emotional system, and that's exactly what we're going to be talking a lot about today with values. And when our behaviors change because of chronic pain, for example, contacting the things that are really important to us, if we're doing less of that, you can imagine what's going to be the emotional impact that that has. When we begin to feel sad because of those losses, or grieve the loss of those experiences, how does that make you feel physically? And how does that ultimately impact the way that you think about your future, about how you're doing in that particular moment? And then on, that dynamic interaction continues. So when we think about and talk about pain behavior, or just the behavioral system in general, the fear avoidance model of chronic pain is really, really important to talk about. The fear avoidance model, I'm just going to go briefly through a couple of the major components, is it may start with an injury or some sort of disease process that triggers or activates the pain experience. This side of the model shows that with low fear, anxiety, generally over time, we begin to confront or re-engage in life activities. This helps with the healing process, and eventually leads us to recovery or to maximal physical functioning. However, this is the side of our model where there's a lot more disruption that can occur, and where we generally leads us to the chronic pain experience. So following injury or disease process, we have this pain experience. We think about that, or we have that cognitive reaction of pain catastrophizing. As I mentioned briefly, it's thinking about the situation in worst possible scenario or terms, with the idea that you have absolutely no control over what you're going through. And you can imagine with that thought process, this is of course going to lead to fear and anxiety. Anytime you move your body, it may trigger a pain flare, or it may re-injure you. So with that emotional reactivity in the context of that negative pain catastrophizing thought process, of course it's going to lead to avoidance, or leaving a situation if there's any hint that pain might increase. It might also lead to hypervigilance, or just looking out for anything that could possibly lead to more pain. Then over time, this leads to disuse, deconditioning, disability, atrophy of muscles, and eventually can lead to depression. And in the context of chronic pain, up to 60 to 80% of people at some point will develop a significant major depressive episode. That is far greater than what you'd see in the general population among people who don't have chronic pain. And then this feeds back into the experience of pain. As you saw a few minutes ago when I showed you that dynamic interaction, all of this is happening together, and it's interacting, which can cause the thought process to become more negative, the expectations that pain will only get worse, fear and anxiety to be worse, and so on. So this is often where people begin to get stuck. And by avoiding those activities, they are also avoiding what's important to them. So the behavioral system has become disrupted, derailed, and valued life activities have tended to either be eliminated or go by the wayside to some degree. And those changes in behavior and life engagement of important activities have consequences. So I want to show you this, this picture as a way to walk you through that process. So try not to get caught up in the busyness of it. I'll just walk you through. So we have here on the furthermost left side, this is a little road or your path towards, we'll use the example of your career as an important direction or life value. And as you're living your life towards a productive career and life in that career, you're following your due north. This is your compass. But somewhere along the way, you have an injury or an accident, or you have just a disease process that causes pain. And anytime you move or anytime you do something, you might have the thought that, you know what, I just can't do this anymore. It hurts too much. I don't want to do this anymore. I can't deal with it. It leads to fear, anxiety, anger, sadness, depression. What are some other physical reactions that might happen in that context? Well, your breathing might change. You might have muscle tension. You might have electrical pain. You might have nerve pain, pounding, soreness, a variety of just physical sensations that surround the pain experience, nausea, your muscles can atrophy, and on and on. So in an effort to avoid some of these experiences, whether they're the negative thoughts that you can't perform your job, the emotions that you don't really want to have contact with, or those physical reactions, it begins to move us further and further away from our path toward a productive life and career, towards what I call the emotional detour. And while the pain and maybe the contact with some of those emotions and other experiences are temporarily reduced, this is also where our life values are not being actualized. We're not connecting with family or friends or hobbies or other things that we have decided that are deeply important to us in our life. It's like having a waterfall that produces just joy and a good positive feeling that you can turn to at any time when you're having a life that's full of activity related to your life values, and you can put out your metaphorical mug into your waterfall of life and take what you need when you need it and when you want it. But that waterfall begins to dry up when you have chronic pain, and you're avoiding the activities that either trigger pain or are associated with these other experiences. And this is what we call the secondary pain experience. The primary pain is what you have as a result of your disease process or your injury or your accident. And that causes primary pain. But the secondary pain is what is the result of avoiding all of those things that might make the primary pain a little bit worse, but it compounds it, because now life is still happening with pain, because it tends to not get rid of the pain altogether, but it's also taking away those other sources of joy and happiness that might otherwise be there. And this is also what we call suffering or emotional suffering. When we're avoiding the pain or the activities that trigger an increase in pain, as a result, there's consequences, and this is the emotional suffering. So with behavioral change, the idea is we want to move towards what's important in your life, moment to moment, even if it means making modifications or changes to the ways that you did those activities at some point in your life, even when there are barriers or challenges to engaging in those activities. So pain, of course, may not go away. And if it's still there, would you be willing to connect with those important life activities, even in the presence of pain? And that's a choice that you have to think a lot about and consider what are the consequences of not doing it. So we think about moving with resistance as opposed to fighting against it. So pain is shown up. It's not something you signed up for or maybe necessarily want to have or continue experiencing, but it is there. And the more that you flow with it, there's flexibility in behavior. But the more that we fight and resist, the more that these behavioral processes break down. And that's what I mean by when we have less connection with important life activities. So how do we get back on track? How do we reconnect with our life compass? Well, the first and foremost important thing is to be aware of that fact that this is happening. A lot of times as human beings, we don't want to feel distressed or uncomfortable. So we do what often ostriches will do, is we put our heads in the sand. And we don't want to look at it. We don't want to think about it. We don't want to acknowledge it. But if you're going to make necessary behavioral change in your life, you have to be aware. You have to be aware of what are your physical reactions? What are your thoughts and expectations? What are the emotions that are happening around this? And how has your behavior changed? And when you are more aware, you're in a better position to start making choices that are based on the things that are important to you, as opposed to what pain is going to tell you to do. Pain will always do what pain always does, which is tell you to stop and to not do the things that might make pain worse. That is exactly what pain is supposed to do. That's its job. It's its biological wired thing to do. But as you just heard me talk about, there are consequences to that. So having awareness is key. Knowing and acknowledging that there's primary pain and that the secondary pain is the emotional suffering that comes up around the avoidance process. Because not only are you avoiding the things that may trigger or exacerbate pain, but that also comes with it a necessary reduction in contact with those things that are also important to you. The third step is to identify or clarify what are your life values. What's most important to you? What has gone by the wayside as a result of not doing the things that pain tells you not to do? When you reconnect with those values, it'll have you starting to think about what are actions that I can take to help me reconnect with them? What are modifications that maybe I can make so that while I may not be doing these activities the exact same that I want to be doing them or have done them in the past, but they allow me to contact it with these modifications to bring me some of that emotional connection and valued actualization that's necessary for a fulfilled life. Asking yourself next, are you willing to have pain in the service of living your life that involves the value that you've identified? If you're not willing to, this is the conundrum. This is the stuck point that I see a lot of people really struggle with. Sometimes there's no willingness to have some pain, and that can make the choice to move towards life values incredibly difficult. So that's something to think about. And then last is to choose your path, your direction. Which direction is your behavior going to go in line with that life value? setting your goal, as we've talked about in previous branch out sessions, your SMART goal, specific, measurable, action-oriented, realistic, and timely. Setting those SMART goals and then beginning to move and take action. Any movement, no matter how big or how small it may seem, is you taking a step towards reconnecting with that value. And that has deep, deep importance emotionally, spiritually, in so many important ways, to help change the direction of that downward spiral that you can imagine in the fear avoidance model that I talked about earlier can begin to take you. So by reconnecting with your values, you're slowing that downward spiral down and starting to turn it around into an upward direction. And before I pause for questions, I just want to quote Michael Jordan, who's been credited with this saying that you miss 100% of the shots that you don't take. So if you don't make an attempt to change what you're doing, you're absolutely right. You're not going to make that shot. It's not going to happen. But if you take some action, one step, any movement at all is taking a shot that you actually now have a chance. It may not be 100% success, but it's going to give you life experience that can be really meaningful and important. So with that, I will be stopping the recording in just a moment, take some questions. I will encourage you to use the comments to ask your questions or just to share any thoughts that you have. So let me see here if I can figure out how to stop the recording. Okay, that has now